And this is the evidence. Least deprived area on the left, most deprived on the right. Staggeringly, even in the least deprived areas, 35% of people feel there is some or a severe lack of social support. If you move across to the right of the graph, nearly half of the people who live in the most deprived areas feel there is social support or a severe lack of social support. There are lower levels of trust, and accessible neighbourhood resources are strongly associated with physical activity and a social network. So very important things to take on board. So some of the key themes from our evidence. Firstly, reducing health inequalities is about social justice. We need to tackle the social gradient in health. Focusing solely on the most disadvantaged, as we have done, will not reduce the steepness of the gradient sufficiently. We need to take what we called, it's a horrible sociological term, proportionate universalism, that we need to address the whole of the gradient, but we need to invest in proportion to the disadvantage that people have across that gradient. Another blindingly obvious outcome is we need to address the social determinants of health. Education, housing, transport, and I've now probably visited 70 local authorities across England, and what you see is people making valiant efforts at focusing on the social determinants of health. And within 18 months, they've drifted back into lifestyle and are promoting smoking cessation teams because they're easy to do, they look really good, politicians like them, and you can fund them with funny money rather than changing the way in which we change our mainstream funding of services. I've already given you the facts in relation to why reducing health inequalities is vital for our economy, both on a financial and a human basis. That we need concerted action across central government, local government, the NHS, the third and private sector and community groups. And the centre of our action needs to be empowering individuals and communities. People and places are critical. Health, well-being and resilience go together. And what we know is that some communities are much more resilient than others, and it's not necessarily the poorest or the richest. As we go into recession, we need to understand, particularly as local authorities and the local NHS, that if we don't address the issues of health, well-being and resilience, services are going to be overwhelmed by those who are the victims of the recession in relation to unemployment and a loss of income. Clear evidence of a linkage of low-level stress, depression and isolation. And here's a quote from one of our reference groups. A young woman with 2 children said, "You can see the deprivation. All you have to do is look outside. It's in your face every day, litter everywhere, rats and rubbish. It's a dump. It feels like people around here have no meaning to life. I keep my curtains closed at times. It doesn't give you a purpose to do anything." Many deprived areas are marked by exclusion, lack of trust, isolation, underdeveloped social coherence, and here I feel safe, but there are places I don't go. Our task is about developing communities and building resilience, and there's lots of evidence to say if we increase participation and improve life skills, that ameliorates the impact of health inequalities through developing social network supports. Some of it is about personal support, and this is a quote from my own doctoral work, which was interviews with 12 women involved in community development in the very deprived ex-coal mining areas of Wakefield. And what Mary said was, "I know I've got backup, and that's a really important thing to me." Other people learn social skills and take community action. It was just getting worse and worse. The group decided we ought to be lobbying people that could help us, MPs, local councillors, local members and the police, and they did something about their environment. And my final quote from my doctorate relates to social networks, and this is a 22-year-old Suzanne who's living at home, fractious relationship with parents, very depressed, who gets involved in community development. And she's asked the question, what makes people healthier? And she said, I don't know what makes people healthier. I know what makes me healthier, and that's being happy and having friends. A simple message, but quite profound in relation to where we need to go. Sorry. If inequalities in education, housing, employment and health are all driven by the same cause, there cannot be a single sector response. We must work as a partnership. We need transformational change and strong civic, executive and community leadership beyond individual agency action into a people and place-focused effort looking at the total spend in any one area. We need to move away from our short-term, project-driven, target-driven objectives and take a long-term generation perspective with vision, leadership and political capital to create an integrated response which is scaled up and of such intensity that it can actually address the steepness of the gradient. Colleagues in the Northwest are to be congratulated. As I say, I've been to 70 local authorities. I've collected information across the country. I think living well sits at the heart of what we've been trying to do and the initiatives we've been taking. Other areas would include the Greater London Authority, and it's remarkable sometimes who your bedfellow is, and I know that Boris Johnson is driving forward in relation to a living wage for London and implementing the mayoral health inequality strategy, which is based upon the principles of Marmot. Michael joked that when he first read the London health inequality strategy, he said, I thought to myself, I could have written that. And he read it again, he said, I think I have. So there is a movement. 30 or 40 local authorities across the countries are signed up to implementing the Marmot Review. And if we do, there's one big message, that we, particularly as the public sector and the third sector, need to focus on giving people control of their own health and their own lives. And our job is to create the conditions within which they can do that. Thank you.